Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Tuesday, August 3, and we are here to take your COVID questions. We have gone back to twice a week, given the volume of questions that we've seen coming in. We actually are also doing a stand-up press conference this afternoon at 1 o'clock, so we'll be talking, mostly answering questions, looking at data in some more detail right now, taking your questions directly, and then doing some travel order updates, some more talk about what's going on around town this afternoon. So thanks for joining. As always, you can put your questions directly into the box below on Facebook. You can use the hashtag AskDrArwady on either Facebook or Twitter. And let's go ahead and dive right in. So we're going to start with our COVID data. CHI.gov/COVID-. And I know a lot of you are looking at this closely again because our numbers have gone up quite a bit. And we never stopped looking at it closely, but we've been following along. And behind the scenes, we do even more than what you're seeing here. But really, much of what we are following is available. We've really had a goal to try to be as transparent as possible, post what's available so folks can create their own graphs, look at things their own way. So if we take a look here, we see that we are now averaging 234 new cases per day on average here in Chicago residents. That puts us at about 8 per 100,000 per day. That does continue to rise, not a surprise. That's what we're seeing really as Delta gets here. We're averaging still just 9 to 10 hospitalizations a day. You see just a very small rise, much better than what we had seen even in that April, May, and dramatically better than what we'd seen before, and I'll show you that in a minute. Deaths also remain really the lowest we've seen them, essentially, averaging 1.1 case deaths per day right now. We're doing about 3,200 vaccinations, which has been flat for the last few weeks, doing about 8,000 tests a day, and our positivity is at 3.3%. So in terms of some context here, let's go ahead and pull up a few slides. Okay, so this is the community transmission matrix or community risk matrix that we've been using all along. We've not changed a single number on this graph at any point. And the only change that we made is with the new CDC guidance that came out, what in that middle column that we had been labeling sort of moderate transmission, they decided to label it substantial transmission. But the cutoff remains the same, essentially. High transmission remains the same, and then you see where very high is. So just to help cut down on what could be potential confusion there, we changed just the name of that middle column. So what you can see is that in the 4 main metrics that we're following that are public facing, our case rate has now moved from the lower transmission point into the substantial transmission range. And in that setting, that's why we followed the CDC guidance. And while we get through this Delta surge, are recommending again that everyone, regardless of their vaccination status over the age of 2, wear a mask in indoor settings. You see our test positivity is at 3.3%, still in that lower transmission range. Hospital beds are doing fine. There's about 125 folks hospitalized with COVID across the city, and then 42 hospitalized in the ICU. And to put this in some perspective, we shared some of this last week, but I know not everybody was able to see slides. So this is our daily COVID diagnoses going all the way back to the beginning of our pandemic here in Chicago. So what you see is at the beginning, we had this surge in COVID cases, but there was much less testing available. And this is one of the reasons we follow cases, but we also follow hospitalizations, we follow deaths, because testing has actually been very good for people who were sick enough to be hospitalized, even from the very beginning of the pandemic. So we had a bigger surge here in our peak in November, December into January. And then as vaccines started to come in, our last sort of smaller surge in this April, May time period, this was really when Alpha hit hard. But the levels that we were seeing with that surge were quite a bit different. And that's because a lot of folks were already vaccinated. And you can see here, we're on the way up. I expect this to continue to rise. But I am not expecting to see the major surges like we were prior to vaccines. And for some context, I know people are concerned because our numbers are back over 200, but there were only 13 days in all of 2020, and that was in June, over a year ago, that we had fewer than 200 COVID diagnoses on average. So we still, compared to where we've been, we remain in quite good shape. And there's been a lot of attention on breakthrough infections, but I want to make sure all of you understand 99.9% of vaccinated Chicagoans have not been diagnosed with COVID since being vaccinated. 99.9%. So I know that it worries people when they hear this, and we certainly investigate them. This is when we're looking to do additional investigations, additional genomic testing, looking for that genetic fingerprint, wanting to make sure we're not seeing new variants, et cetera, but really want to put that risk in some context. And that is actually true across the US as well. So the breakthrough cases are getting a lot of attention, but the risk overall is dramatically lower for folks who are vaccinated. And then if we look at hospitalizations in comparison, you see here in the first graph, this on the left, you see how the cases were lower in March, April, May than they were in November, January. However, hospitalizations were the opposite of that pattern, and that's mostly because of how much testing was available early on. In the beginning of this pandemic, we had testing positivities of 20%, 30% even, and really the hospitalizations, when you're comparing, both to be able to compare across surges, as well as to really understand the severe outcomes, which is why we have to be so aggressive potentially if COVID is threatening the healthcare system or causing such a large number of hospitalizations and deaths. We got hit by far the hardest right at the beginning. I will tell you, throughout all of COVID, the most worried I was for sure was right at the beginning here, when the numbers were shooting up dramatically. We had already seen healthcare systems starting to get overwhelmed in places like New York and Italy, and we're not sure sort of how high this would go. By the time we got to this surge, this is a lot of hospitalizations, but we'd learned a lot more about how to take care of folks with COVID. And then you see that in this smaller surge, when really some of these variants started hitting us more, certainly a surge, but smaller because primarily of vaccination. And here, I do expect this to go up a bit, certainly, but again, not expecting to see anything like we were seeing back at the beginning of the pandemic. And again, since January 2021, 97% of COVID-19 hospitalizations in Chicago residents have been in people who are not fully vaccinated. And then where we look at breakthroughs, remember I said 99.9% of vaccinated Chicagoans have not gotten COVID. It's actually more than 99.99% of vaccinated Chicagoans who have not been hospitalized with COVID. And then deaths follows the similar pattern as what we saw with hospitalizations. These are also very good for comparison over time. And this is what makes COVID really so different from flu, right? The huge number of hospitalizations and deaths, more than 5,600 here in Chicago. The largest peak, certainly in that first surge, another peak in the second. And then with vaccines here, you see more like what the surge looked like when the last variant came through. And then here, you see we've had a number of days actually with no deaths. This is slightly on the rise, but we're averaging 1 death a day. We would have killed for an average of 1 death a day at any point before vaccines were available. And so again, since January 2021, 97% of COVID deaths in Chicago residents have been in people not fully vaccinated, and 99.999% of vaccinated Chicagoans have not died of COVID. So I hope that is, somewhat reassuring. Certainly, we're seeing this Delta come, but it is especially landing on people who are unvaccinated, and people who are vaccinated, we're not seeing a lot of that breakthrough. And to put this just in some perspective weekly, again, in the first surge, we were averaging almost 50 deaths a day at the peak, which is just a huge number of deaths. In the second surge, it was about half that, 25 per day. In the third sort of small, mini surge, when vaccines were available, we were seeing about 7 deaths a day, and currently we are averaging 1 death a day. As cases go up, that probably will go up, but again, not expecting something similar to what we'd seen in the pre-vaccine surges. And we've shared this. This is something some of you were even sending to me. This is some graphs. This is national data, but our ours is similar, and we're going to make a Chicago version. Just highlighting that in green here is everybody who's vaccinated. Red are people who, among that, have symptomatic breakthrough infections, and then the yellow in that corner are breakthrough deaths. And then this is how every week we're updating this. Again, just making the point through March, that smaller surge we had when when the Alpha and a couple of the other variants came through, what we saw in the red line here was the weekly case rate among unvaccinated Chicagoans. The dotted line were among people who were partially vaccinated. They'd gotten at least one dose. And if you think back, March, April, that was still, we were still really going on vaccination. And so we didn't have, we had many more people who were partially vaccinated at that point. And one thing we've seen clearly is that it's important for people with Pfizer and Moderna to get both of those doses. And then the dark blue line on the bottom are people who are fully vaccinated. So you can see a little teeny bit of an increase there for cases. But comparatively much more among the red folks who are unvaccinated. And then you can see as our surge is starting here, we're seeing that same pattern and certainly following. And we've gotten some questions about, why are you not tracking cases? We are tracking cases. So this is cases. This is breakthrough cases in Chicago. What's being reported up to CDC are hospitalizations and deaths with more data, but we are absolutely tracking breakthrough cases here. This is the hospitalization data. Again, the same pattern. With the most recent surge, saw it very heavily fall on people who were unvaccinated, followed by people who were partially vaccinated. And at this point, not really seeing a change there. And then this is deaths and that same pattern. And we had also highlighted, we've done more than 3 million vaccinations here, and at least 40% of age-eligible Chicagoans, meaning those over 12 in every zip code of Chicago, have now been vaccinated, which is good. You can see every zip code here is shaded. The darker the blue, the higher percent coverage among those 12 plus. And if we look here, so on the left, this is highlighting that all of our zip codes are at least 40% vaccinated. Then there are 6 zip codes that are between 40 and 50% vaccinated. So you can see over here in Austin, and then 5 zip codes on the south side are all over 40%, but less than 50% vaccinated, which is a concern and is an area where we're definitely continue to put increased emphasis with our Protect Chicago Plus work. And then if you look at who's between 50 and 60% vaccinated among age eligible, again, you see it's these 13 zips in the community areas here that have consistently been where we've been doing the most work and where we still have the farthest way to go. But I want to highlight that there are all over the city, there is still work to do. So on the left here, broadly we would like every zip code in Chicago to be shaded blue. On the left, we see where at least 70% of the eligible population is vaccinated, which is pretty good. However, you get to 80% and you can see it's almost nothing, and you get to 90% and it's really just a couple of our very small zip codes in the loop. I would really, really like to see some of the zip codes that, I'd like to see every zip code move forward, at least 10%, if not 20%. So the zip codes that are now at 70, I'd like to see those get to 90. The zip codes that are now at 50, I'd like to see those get to 70. Every time we get another person vaccinated, we decrease, first and foremost, the risk for them. But then secondly, there is this indirect protection for those around them, and it helps decrease the risk for prior variants. So I wanted to also just very quickly highlight, why we feel more confident about this surge with a little bit of the data that we look outside of Chicago. This is an international example. I just pulled this data right off the publicly available UK dashboard today. And what you see on the top here is they did have this major surge in cases with the Delta variant. I just grabbed the graph for them from September, so you can see they had a big surge just like we did in November and January, came down very low, and then had a big Delta surge. You can see actually their cases were almost as high between their surge in January and their surge in July. And nearly all of those cases were the Delta variant, which is more contagious. However, thanks to the vaccine, even in the setting of this very big case surge, which you can also see is now very much on the way back down, which is also good to see, they've seen dramatically fewer hospitalizations and deaths. So see how high the hospitalizations were compared to the peak in January, and then what we saw with hospitalizations with this peak in more recently in July. And then similarly, if you look at the deaths, right, the very big peak of the deaths, this is pre-vaccine broadly, and then just a small increase in deaths. And that is because of vaccine. Hospitalizations and deaths didn't even get to 1/15 of the peak of what they had been, and dramatically falling on people who are unvaccinated. And then similarly, here's a US example from San Diego. Again, places that have seen the Delta surge a little bit before us. We've had the benefit of being able to see how it's been showing up in other settings, and the team watches this kind of stuff around the country. And what you see here is that, you know, their surge really kicked off at the end of June, beginning of July. We're a few weeks behind there. But what I want to highlight is that the orange here are San Diego residents who are not fully vaccinated. The blue is all county residents. So if you're just looking at, you know, what does it look like, you see, yeah, there's a surge. And then the green is among those fully vaccinated. So really, these patterns that we're seeing internationally and around the country remain reassuring around how well all vaccines are continuing to work to protect against those severe outcomes. And I hope that helps put some of what we have more recently into context. Okay, so let's get to your questions. All right. Is there a COVID-19, so here's Faye State on Facebook, who we know you're a frequent watcher, I recognize your name. Is there a COVID-19 hotline or number that people in Chicago can call to ask questions on COVID-19 to make sure they have the correct information? It's important to have, especially for the many people who do not have a medical provider that they can call. So 312-746-4835. That's your number. That will get you to our vaccine ambassadors. That will get you to people who can help get your questions answered. That will help get you to people who can schedule a vaccine for you, find your second dose, set up an at-home appointment. They are there purely to help answer your questions and get any barriers that you have out of the way. So please do call that number. We also were really reiterating that I would love, you know, I know that there are still a lot of folks who have not made that decision to get the vaccine. We are at about 68% across where you look at all ages, 12 plus here in Chicago have gotten the dose, around 70% if you just do 18 plus, and around 50% of our adolescents, 12 to 17-year-olds. But where people still have questions, we like people to have questions, but I want to make sure you're asking somebody who can help answer those. So talk to a doctor, talk to a pharmacist, talk to someone in healthcare, certainly check reputable sites online, or you can always give us a call. Wild card on Twitter. I keep asking, but you refuse to answer. What are shooting cases versus COVID cases in Chicago? What are homicide numbers versus COVID death numbers in Chicago? So actually, I had on Thursday, I had our behavioral health lead for CDPH on, because we've been getting a lot of questions about mental health and substance use and violence. And what we shared was that, obviously in 2019, our COVID deaths were 0. Right? This was prior to COVID. In that year, across Chicago, gun-related homicides were a little bit under 500. Our opioid overdoses that same year, when COVID was 0 and gun-related homicides were a little under 500, our opioid overdoses were actually in the 850 to 900 range. So quite a bit more even than the gun-related homicides, which is why we've needed to be, you know, really trying to work on substance use issues. Then when we got into 2020, we've seen this huge number of COVID deaths. Again, more than 5,600, and you can go to the dashboard if you want to see the exact number of COVID deaths in Chicago. About 800 of those or so have been in the year 2021. The rest were in the year 2020. And so during the year 2020, in this year of, you know, 4,800 or so COVID deaths, we saw homicides also go up from about just under 500 to just under 800. So a big increase there, but you know, still COVID deaths, unfortunately, you know, 4 to 5 times that. These are both major problems, but the difference is that we have a vaccine available for COVID that can help really put this one behind us while we continue continue to take the lessons that we learned from COVID. And then in that same year, last year, that we saw the homicides go from just under 500 to just under 800, we saw overdoses go from about 800 to about 1,300. And those increases in gun-related homicide, those increases in opioid overdose have been reflected across the whole country. I think, there's what we say multifactorial that are driving this. Certainly where we look at the opioids, there's been more of the fentanyl, which is stronger, that's been in the drug supply and unfortunately has caused more fatal overdoses. And these numbers we give, unfortunately, are fatal overdoses. But also these increases in violence and substance use, at least in part, are linked to just a lot of the disruption that came with COVID. So I hope that answers your question. And if you have more questions, I'd refer you to last Thursday's COVID update, where we had Matt Richards on as our leader for behavioral health at CDPH. Margie L. Taylor from Facebook is asking us just to repeat that phone number again, 312-746-4835. 312-746-4835. You can also go to chai.gov/COVIDvax. The number's all over there. A lot of information is all over there. Frequently asked questions, videos about variants, all kinds of things. So thanks for that. Okay, so let's see. We've got Tiffany Hagstrom on Facebook. Why do you think vaccine efficacy data out of Israel is lower than other studies from other countries? There also seems to be a lot of conflicting information about when different age kids can get the vaccine. Would you clarify? Okay, Tiffany. So first of all, always in science, what we do is look at a lot of different studies and see what is repeated over time. What have we learned? What is different? And you're right that there have been, in particular, there was one study out of Israel that was more concerning around seeing some decreased efficacy, meaning the vaccine were not as protective against cases, although they remained highly protective against hospitalizations and death. That has not necessarily been what we've seen in most other countries that have been looking at this. And there's some theories that it may have to do, Israel has a very aggressive testing program. They may be detecting more people with asymptomatic COVID. There are not necessarily questions, related to spread there. So that's a hypothesis, but it's something we're learning. Israel has been doing a really good job with COVID. They've been a place that I think we can really learn from. They were the quickest country to quickly get a high number of people vaccinated. And so we were able to see some of the indirects of vaccine earlier. There's a couple other people putting in stuff about Israel. I want to highlight there was a New England Journal of Medicine article that came out just this week from Israel. So it was looking at breakthrough infections in fully vaccinated healthcare workers, right? This has been a topic. I know we're getting some questions on it. Obviously, healthcare workers who continue to care for people with COVID in a surge are at high risk for COVID. And so we remain really, interested and concerned about breakthrough infections for that group. It's one of the reasons we've been, really, really pleased to see healthcare settings in Chicago stepping up and making vaccine mandatory for healthcare workers. So what they found here was that in a study of almost 1,500 fully vaccinated Israeli healthcare workers, they had 39 breakthrough infections, meaning people who were fully vaccinated and still got COVID. It's a really good study because they did a full epidemiologic analysis. They looked at what levels of virus were we seeing. They did a controlled study. And the main thing is they found, that sounds concerning, certainly, 39 people who have been vaccinated. That's 2.6%. So again, 97% plus in that setting were remaining protected. And this is a setting where there was all of this repeat testing going on. The other thing I wanted to just highlight, a lot of those folks who were found to have COVID actually were asymptomatic. They didn't realize it. But they did not find any of these workers transmitting COVID, which is important. And one of the main questions that we're the most interested in understanding, and some additional data about that. So there were no what we call secondary infections identified. And the researchers said, that suggested that the infected workers who were vaccinated were likely less contagious than their unvaccinated peers, even if they had COVID in their nose. And then the other important thing I thought from this study was that so there were 39 healthcare workers, 37 of them, they were able to kind of get the full investigation done. And the likely source of COVID infection for all 37 healthcare workers with available data was an unvaccinated person. okay? So, and specifically, it was a household member in 57% of the cases. So if you know someone who works in a healthcare setting or not, and you're getting everybody vaccinated in the household setting is as much as possible is really important. That remains the place where people are in closest contact. And so in this breakthrough setting, in this really well done study, people were all getting it from unvaccinated people, and 57% were household members. And then in 30% of cases, the suspected source was an unvaccinated, either fellow healthcare worker or a patient. And there was 7 of the 11 that had a single hospital outbreak where there was an unvaccinated patient who'd been getting a special kind of ventilation that can really aerosolize COVID, and in that setting, there were some breakthrough infections. And so I like the study. I would refer you to it because I think it helps put some more context around this, that obviously getting yourself vaccinated is the most important thing. None of these folks had, the severe infections had to be hospitalized, et cetera, but they're still at risk in these riskier settings, but it's unvaccinated people who are then spreading to them. And that's one of the reasons it's not just about you. When you get vaccinated, the most important thing is that you protect yourself. That's clearly the main thing that happens. But there's this secondary benefit that you also protect people around you, and especially folks who are unvaccinated, but even folks who are vaccinated, right? We're learning, in all settings that the more people are vaccinated, the less risk there is for everybody, and the less risk there is to see new variants emerging. So I think Israel remains a place we watch really closely because they're doing some very high quality data out of there, and this was a good example. Okay, we've got a question here from Justin, and another one from Marina Slattery on Facebook. How do you really know 90% of Lala people were vaccinated? Marina Slattery is asking, why did we allow Lollapalooza? And now we're getting schooled about the new variant. Annoying. Okay, so let's put both of these in a little bit of context. So first of all, to Justin's question, how do we really know 90% of Lala people were vaccinated? So first of all, I cannot say loudly enough how glad I am that we set this as a requirement from very early on, really worked with C3 and the promoters of Lala. We made this decision to move ahead even before we were fully reopened. And since we've been fully reopened, we have allowed all permits to go ahead. When we are open, we are open. However, where there are settings that are of more concern, especially if there may be a lot of travelers coming in, et cetera, we really felt strongly it was important to have this vaccination or testing requirement. We are unusual in doing that, to be clear. Most music festivals across the US, really big ones even, are not having a testing or vaccination requirement. I don't think that is wise with the increase in the Delta variant. So how do we know 90% were vaccinated? So the Lala folks, certainly, they were the ones doing the actual checking. And just as an aside, I actually went through those gates multiple times, not known. I put a hat on, I put glasses on, I put a mask on, because I didn't want to go through as Dr. Arwady, where they're going to sort of put on a show. I wanted to go through as somebody in the big line of people, and I wanted to see what they were doing with the proof. And I also actually did not bring my I didn't bring my COVID CDC card because I also wanted to see, right, would that get extra attention? I brought a printout from iCare, which is the official Illinois registry. That's an accepted document, but it's not going to be the standard one. And I was really pleased. These people didn't know who I was. I was in the middle of a big crowd of, other kids coming in. They stopped, they looked at, this is something different. Because I printed it out of the central vaccine registry, it had my tetanus and my HPV and all of my shots, and they were like, okay, where's the COVID ones? They had to see the dates. They had to see that there were 2, make sure there were 14. They were looking to make sure, where it was from. I was pleased. I got appropriately stopped, and they were looking at it. And we saw a lot of people getting turned away if they didn't come with anything. And we had a couple of our own folks come, actually, without their cards, and they appropriately got turned away and, had to come back with proof. But then also if the dates weren't good. They turned away people if it was at least 14, if it had not been at least 14 14 days since they were vaccinated, they had to go get a test, or if the test was not within the last 72 hours. So especially on that fourth day, there were some people who'd gotten a test 72 hours before. They're trying to still use that test. It's not within 72, pushing those folks out to get another test. And then they were doing basically sampling at all the different gates, so we could get a sense of what is the vaccine percentage versus not. And we saw in some of the at some gates it was higher than others. There's different pieces, but overall, really consistently over that 90%. However, in addition to what Lala was formally tracking and doing there, we sort of behind the scenes, we had our vaccine ambassadors on site, which I believe I talked about on here. They were there. They had a tent. They were wearing vests and out walking around, giving out information and swag, if you will, sort of about vaccines, actually answering lots of questions, but then also signing people on the spot if they were not vaccinated, if they instead were tested, signing them up for vaccine, some of our at-home vaccine appointments if they were willing, and then they were doing their own tallies. So behind the scenes, sort of literally like how many of the folks are vaccinated, how many are tested as they were doing that, and their numbers were absolutely consistent with what Lollapalooza was seeing. So, and that was in thousands and thousands of clickers. This over 90% is real, and it's what we expected, because we saw a whole lot of young people get vaccinated to attend Lala, to attend, not just Lala, but some of these other music events. That was a big promotion for us here locally. And frankly, if all of Chicago, if all of the US were vaccinated at the level that the folks attending Lala were, we would probably have COVID largely behind us. So I do think there will be some cases associated with Lala. There's no way around it. We expect that there will be with the number of people that are there. But for an outdoor event and for requiring vaccine or testing, and that this is an event that really attracts younger people for the most part, it's why we decided to move ahead. And hearing this new information about the variant is here not because of Lala, just to be super, super clear about that. The variant, all the variants actually have been here, 4 months, and that increase that we were seeing was here not as a result of Lala, but just as a result of the fact that we're entering that Delta surge. So, and I hope if you look at some of the timelines, answer it. So there's a lot that we're doing to follow up on this. We will certainly keep you posted as we learn about that impact. But I feel, very glad, especially with some of the new data, that was out, that we had that requirement. And thanks to Lala again for being willing to do all the extra work that came along with that. We're doing things to make these events as safe as possible, and there is no such thing, you've heard me say over and over again, as a no-risk environment. I certainly, just for what it's worth, I felt very comfortable inside the gates there. I was always able to keep a distance. I was outdoors. I was wearing a mask. I was not going up to the front where there was some of this crowd surfing going on, certainly. But I felt that I was certainly able to attend without risking COVID for myself, and I think we'll see. We keep learning, obviously, more about these gatherings, but when we're open, there have literally been hundreds and hundreds of events that have been tens of thousands of people here in Chicago that have been gathering, whether that's baseball games, whether that's other concerts, whether that's street festivals, whether, block parties in some cases. Out of doors, highly vaccinated is the two most important things that we can do to be open and be careful. And really, that's our goal, to be open and to be careful. And careful means getting vaccinated, and then right now, while we're getting through this surge, indoors, please put a mask on. Okay. Question here from Patrick. What other variants are there besides Delta? I heard about Lambda. How concerned should I be? Okay. Good question. Let me sort of take a quick step back, because we do get a lot about variants. So there are going to continue to be new variants that emerge. There have been variants that have been emerging for as long as we've known about COVID. And let me just again remind you, there are these 3 levels of sort of worry when it comes to a variant. There are probably thousands of, quote, variants at this point that have been detected around the world. Most of them do nothing to make the virus more contagious, to make it more deadly. They just emerge. We watch them. Once we start seeing clusters of one of these variants, at the end of the day, what's the goal of the COVID virus? It's to reproduce. It's, it's evolution. It's the same as every living thing. And so they use human cells to reproduce. And as they reproduce, there's the survival of the fittest, right? So if there is a variant that comes, and variants come when COVID spreads, to be clear, it's copying itself inside of the human, and as it copies itself, there are typos, basically. And if that typo happens to make the virus more successful in terms of replicating, reproducing itself, or more successful in terms of making people sicker, having higher viral loads, or being able to evade vaccines or treatments, that will make the virus survive, and that is a more fit virus. And so what we see is that if you start to see not just an occasional genetic fingerprint that looks different, but you start to see a little bit of a group that have the same mutation in them, that gets labeled what's called a variant of interest, or a VOI. And the WHO labels variants of interest at the international level, but then countries will also label them depending on what's going on at this point. So the Lambda variant, which you mentioned, at this point, it's one that emerged in Peru near the end of 2020. We've had a few cases of it here in the US, but it's been labeled a variant of interest by the WHO. It's not even a variant of interest yet at this point from CDC. But variant of interest means we're keeping an eye on it. Variant of concern means not only are we seeing more of these, but actually we're seeing something that makes us more worried. So we're seeing it spread much more easily. We're seeing it have trouble against a certain treatment. We're seeing decreased vaccine effectiveness, or we're seeing it get people more seriously ill. So in terms of these variants of concern, Alpha was the first one. That's the one that was originally called B117 out of the UK. That was the one that was about 50% more contagious than the original one. Delta right now is a variant of concern, because it's 50% again as contagious as that Alpha variant was. Some of the other ones that we had Beta. That was the one from South Africa. One of the first times we saw some decrease against, especially the AstraZeneca vaccine. But that one we're not seeing much of anymore here in the US. Similarly, the, what was it, Gamma, which was the P1, the one originally from Brazil. That one was one, we were actually pretty worried about that here in Illinois. We had more of it here in Illinois than anywhere else in the US. But it eventually, and we were worried about it because it was one that, especially in Brazil, there were a lot of people who had had COVID previously, not been vaccinated, and then got COVID again with this variant. And we were worried we would see some of that. But part of the reason, the Alpha and some of these Gammas were all coming in at about the same time, but then Delta came along, it's more contagious, it's outcompeting all of them. But what I want to highlight is there is a third level of variant. It's called a variant of high consequence, okay? So it goes variants that are just generally variant of interest, variant of concern, variant of high consequence. A variant of high consequence is a huge deal. If you hear us talking about a variant of high consequence, that would be a setting in which we might have to think about revaccinating everybody or potentially shutdowns, et cetera. We have never had something labeled a variant of high consequence yet. It's important for folks to hear that. A variant of high consequence would be really if the vaccine looks like it's not working, for example, or there's been some mutation that's making people more seriously ill. And that's just not the patterns that we've seen. And so what will happen is these variants can kind of move up and down through that level. There were some others, Epsilon and Zeta and Theta, that at one point were a variant of interest and came on and came off. But you're going to keep seeing, there's going to be new variants. Every day there are probably some, a new variant being detected, and probably every few weeks to month, as we're still seeing spread, there are variants of interest. Variant of concern is when we get concerned and start thinking about things like putting those masks back on a time while we get through a surge. And if we were to get a variant of high consequence, that would really be something that would have to change significantly the way that we're thinking about this. So I hope that that helps. And I'm always happy to answer questions about individual levels, but remember, variant of interest, variant of concern, and variant of high consequence. And right now, the lambda that you're asking about is just a variant of interest, according to the WHO. It's not even a variant of interest yet, from the CDC. And if you're interested in this, by the way, go to cdc.gov, look at it. You can put in your email address. They'll email you every single time there's a new variant of interest or something goes up or down. There's all kinds of data on there about what we know about those variants. But Delta at this point is really the main variant that we're seeing across the US and here in Chicago. And that has been true, now for weeks. Okay, so Namrata Batra from Facebook says, so to summarize, you're saying the Delta surge is not affecting the vaccinated, as it's been showing in the cable news. As long as we're masked, we should be okay for the most part. Yeah, thanks Namrata for that. So, right, the Delta surge is very, very heavily affecting the unvaccinated. And I think, in some of this news that came out over the last week, there was a lot of I think, sensationalism around, there was this leaked CDC document. When I finally saw this CDC document, we knew 95% of the information that was in that document already. I think there were some, they took some words out of context. There were models in that document that were not actually formal data. They were prediction. We always look at models to sort of predict ahead of what might happen under different scenarios. But I think partly because it wasn't a document that was really designed for public, it was designed for people who spend all day looking at models and looking at this, that there was a lot of, I think, I read the media coverage myself on, I think, whatever night that was, Wednesday or Thursday night when this leak got out, and I was really worried. I was like, what is this data, right? I was reading what the Washington Post had. I was reading some of this, and then finally, the next morning, I got a look at the actual document, and I was like, oh, there's not that much new in here. The one thing that had been newer, there was this study, and again, I would refer you to the MMWR, the actual CDC paper, about in the Provincetown outbreak, that there had been, they've been checking where people have breakthrough infections. There's been testing to see how much virus do they potentially still have in their nose. It's related to something called the CT value. And what they saw in this study, there were a good number of breakthrough infections, but I think what didn't come out was that people who were, even in that Provincetown outbreak, people who were unvaccinated, 8 times more likely to get COVID, right? The vaccinated were not more likely to get COVID, but among the people who did, they were able to detect COVID virus in their nose. However, detecting COVID virus in their nose, we are very much still learning about when you detect these CT values, what does that mean in terms of actual transmission, which is why studies like that Israeli study that look at the CT values, but also say we didn't see signs of further transmission. We are definitely still learning about this, okay? And so I think we had seen prior to Delta that where you check these levels of virus of people who get the breakthrough infections, we had seen, it looked pretty clearly that their level of virus was lower. Perhaps with Delta, their level of virus is the same. But the level of virus, that's not the same thing as oh my God, everybody got COVID who was vaccinated. No, right? 8 times more likely. And then also in this Provincetown outbreak, there were no deaths, and there were 7 hospitalizations. And the amount of sort of concern around that, because it was a highly vaccinated population, right? And so I just want to help you sort of put this in some context. If you are vaccinated right now, fully vaccinated, and you're wearing a mask when you're indoors, I don't want to raise your level of concern, okay? I am not worried at this point as a fully vaccinated person who is out and about in Chicago. I've been wearing my mask indoors for the most part, really anyway. If you are not vaccinated, your risk, though, is high right now and getting higher by the day. And the problem is where there are a lot of unvaccinated folks, that does raise the risk a little bit for everybody, right? Like in this Israeli study, that you do see not a lot of people, but a small number of folks who are vaccinated get the breakthrough infection, and that is more likely. But again, 99.9% of Chicagoans who are fully vaccinated have not had a breakthrough infection, and I don't expect that number to change based on what we've followed around the world. So, you know, my goal is always to try to share with you what we know, what we're still learning, and then have you use that data. At just over 200 cases a day, when we're between 200 and 400 cases a day, that's where we've been for like all of COVID. And before vaccines were available, that's where we were last summer. And I think, you know, we make some of these recommendations to help protect everybody. We don't have a way to know if somebody is unvaccinated or not just looking at them, and the goal is to keep the risk for everybody down. The mask recommendation is not forever, to be clear. I expect the Delta surge to come back down, just like we're seeing in many of the European countries now, just as we saw in India, and I expect it to land, unfortunately, mostly on folks who are unvaccinated, and especially when we look at the severe outcomes, the hospitalizations and the deaths. So please, 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 if you know somebody who's not yet vaccinated, especially if they're older or have an immunocompromising condition, or they're a healthcare worker, or they work in a high-risk setting, please, now is the time, because this is, in a large part, largely a vaccine-preventable infection. And, you know, until I have concern that either the healthcare system might get overwhelmed again, or we don't have a vaccine that remains highly protective, like, for example, if there's a variant of high consequence, those would be the settings in which we would need to probably take some of these much more drastic shutdown type things. Our goal is not at all to do that. Our intention is not at all to do that. The masks are something that, from my standpoint, are a short-term thing that we do when we are surging, when a variant comes along that helps us get through that surge as we protect people who are too young to be vaccinated or who have not chosen, and indirectly protect everybody. I told you earlier, when you get vaccinated, the most important thing you protect is yourself. When you wear that mask, it's actually mostly about protecting others, right? And when everybody's wearing that mask, we are all protecting each other. And that's why we felt so strongly about, you know, having masks universally, for example, when we're going back to school, where those young kids especially are not vaccinated yet at this point. We want kids back in school in settings as safe as they can be. And so we want the mitigations that were in place, of which there were many, and we were able to show very successfully that we're able to be back in school. That was before there were even a vaccine available. So with a vaccine available, with most staff, and hopefully more coming, vaccinated, and making good progress on the older kids, you know, every vaccine also makes school a safer environment. But you know that this is something, again, based on data, right? Like, and my job is to really make these recommendations based on what myself, but my whole team is looking at. What do we know about the science? And I try to make all of those decisions with my whole team based on the science and our local epidemiology. That's like rule number one when you're doing outbreak control. And no matter what else you might be reading, that is absolutely the right way to think about this outbreak. And so we continue to follow those recommendations, and that's why we made that change. Okay, so we are out of time. Let me just see where we didn't get the, just a very quick one here from GM Ballestros is wondering about a 94-year-old mother-in-law. Would I recommend the Johnson & Johnson vaccine for the elderly? I would recommend any vaccine for the elderly, first and foremost. We see slightly higher levels of protection for the Pfizer and the Moderna, but all three vaccines have been holding up very, very well in terms of the severe outcomes for hospitalization or death. Anybody who's 94 is at very high risk for those vaccines, and I don't know why your mother-in-law might not be vaccinated yet, but if she's worried about side effects, for example, J&J has less side effects, it's one and done. I still have patients in clinic, if they're worried about side effects and they're not vaccinated yet, I encourage them to get the J&J vaccine. The most important thing is she gets vaccinated. And if that's the one she wants, go for it. We continue to learn about boosters. We'll talk more about that. No boosters recommended at this point, but you know, if you've got a 94-year-old mother-in-law, the most important thing is get any vaccine. And I think if, you know, given a choice, you know, maybe for someone that age, I might go Pfizer or Moderna, but more important is get vaccinated. And And I would feel, I feel very comfortable where I have elderly patients who have gotten a Johnson & Johnson vaccine. I'm not recommending a booster shot. To be clear, the most important thing is protecting against the severe outcomes. Okay, if we didn't get to your question, we will come back on Thursday and answer more questions. And again, we will be doing a stand-up also at 1 o'clock, just because there is a whole lot of interest again right now in COVID. So thanks for tuning in. Thanks for all your questions. Please be safe. Right now, put that mask on when you're indoors and talk to anybody you know here in Chicago who's not vaccinated. Now is the time. Let's keep those curves as low as we can. Appreciate it.